Gauteng men appear to be shying away from the needle. This week, the provincial health department announced that fewer men were being vaccinated than expected. The department is now ramping up efforts to target some of the mines in the province. To discuss this, I'm joined by Dr. Sibongile Zungu, Gauteng Health Department acting head. Dr. Zungu, thank you very much for your time this morning. So have we identified why men are seemingly hesitant or are not getting to vaccination sites?
Good morning to yourself and to your viewers. At this point, we have realized that men had a number of questions that they would like to clear around the vaccinations, and there are a number of myths that are also emerging around the use of vaccines, and we have then taken a drive together with the Department of Social Development to clear or demystify the myths that are there.
As part of that action or activation, you are heading out to mines to actively go and speak to men there to try and get them to vaccinate. Which mines have you been to so far in Gauteng, and how's that been going?
It has gone very well. We started off with a meeting with the mining sector to address all the mines that exist in Gauteng, and it was quite a good meeting driven by the Premier himself. And we discovered that most of the mines had already started workplace programs to vaccinate the miners or the workers in the mining sector. And they also opened up their sites to vaccinate the families of the miners and also the communities that are around there. And in the last week, both our Premier and the MEC were in the West Rand to visit the mines, and they were quite pleased with the progress that has been made there.
Running concurrently with this, there has also been site expansions for weekend vaccinations across Gauteng. Can you tell us how many new sites have come on board?
At this point, we have 30 new sites that have been opened over the weekend, and that has been pleasing because on some of those sites we saw over 2,000 vaccinations being done in a single site, and that takes us quite far in terms of contributing to our target of ensuring that at some point by the beginning of September we would be at 100,000 vaccinations in a day.
In terms of vaccine hesitancy, we've seen a number of different age groups. As the new age group is opened up for access to vaccinations, there is a lot of eagerness from cohorts in that age group to get vaccinated. But after a while, that tapers off, and then it seems the demand wanes a little bit. How are you approaching vaccine hesitancy in terms of asking community leaders and religious leaders to take a stand and to try and activate proactively for their communities and their constituents to get vaccinated?
At this point, we are having some surveys. There's a survey that is running with Vodacom to look at what could be the contributing factors on vaccine hesitancy. At the same time, also, we are looking at different age cohorts because they are each driven by different issues. And we have seen also that when we go to our social media accounts, those that are 18 to 34 are eager to come in and join the vaccination program, and they are already knocking to say, open up for us. And what we have realized is that as each new age cohort comes in, it brings a new energy, and they then bring along the higher age groups with them, and the explanations that come through, they are assisting the edge to vaccinate. What is worrying, though, is that we are having some groups, some of them professional health workers, that are also spreading some messages that are making communities reluctant. We are talking with different groupings of health workers to assist to ensure that communities have clear information about the vaccination, the safety of the vaccines, and also to understand the possible side effects that come when you are vaccinated.
So, Gauteng was the epicenter of the third wave. We experienced large volumes of daily new cases. We've since passed the peak here in Gauteng, and now the Western Cape and KwaZulu-Natal are leading in terms of the most new daily infections. Do you think the fact that we had such a severe peak here in Gauteng contributed to the numbers of people who chose to get vaccinated?
I think once you realize that COVID is real, you would take it upon yourself to protect yourself. And that did assist to drive the vaccine rollout to some extent. But also what we are realizing now that the numbers in Gauteng are tapering down, we are then looking at opening up our healthcare facilities as vaccination sites so that on a daily basis, we know that when somebody is eager to take a vaccine, there is a site open because our healthcare facilities, especially the hospitals and the CHCs, the community health centers, are open 24 hours a day. And therefore, that expansion on its own will make whoever that decides to go for a vaccine to know where to get it.
Quickly, before I let you go, what is the target? How many people are we looking to vaccinate per day in Gauteng?
As we get into September, we are looking at 100,000 people per day. At the moment, we are between 40 and 60,000 in a day, but we are targeting 100,000 a day. And so each week, we are looking at increasing the numbers towards the 100,000 mark.
Thank you very much for your time, for speaking to us. That was Dr. Sibongile Zungu, Acting HOD of Gauteng Health Department, giving us an